everyone. In a previous video, I covered the topic of breast surgery. In this video, I'd like to cover the specific topic of transgender breast augmentation. Probably the most important thing when you're looking for surgeons is to consider a surgeon who's actually worked on transgender patients before and has good experience dealing with a variety of patients. The reason for that is, and that obviously the male and female anatomy is different, and that there have to be adjustments made for body shape and size. The muscles are typically stronger and bigger, and also the starting breast size. Typically the breasts are smaller, and really ideally you should be on hormone therapy at least 12 months so that you don't get breast augmentation and your breasts continue to grow and then the size is unexpected. So really that's just some guidelines, and talk to the surgeon about that as well. And the thing I think that's really important to think about is that the surgeon really respects the whole process of your transition, and that the office staff treats you with respect and they understand what you're going through. That's really important, and this is an important decision, and I think you should consider those things. The other thing I mentioned is always have realistic expectations. You should look at pictures of other transgender patients, not just genetic women. And so that gives you a better idea of the spectrum of what the possibilities are. In some cases, you may need to go through a two-step procedure, and the reason for that is it really depends on what your body type is like, and also what ultimate size you want to go to, because in some cases there isn't enough space, and so you need to go through two procedures, one to create enough space so that you can get the final outcome that you're looking for in the second step. The other, it's very helpful to be able to talk to other transgender patients as well, and that's very useful because not only will you understand what their surgery was like, but the whole process that they went through, and maybe you'll make a friend. So with recovery, it's pretty much the same instructions we talked about before, but in some cases you may have to work a little harder at the breast massage because part of your body might be much more muscular, and you're going to have to work a little bit harder. So I hope these tips are useful to you and that you have a good outcome.